In the 21st century, can we have an efficient vaccine delivery system that can ensure equitable access to everyone on a global scale? Equitable access meaning access to vaccines regardless of a person's nationality, economic status and gender. And what the hell all this has to do with the illegal drug trade?
Plata o plomo.
Even if you are from a developed and wealthy country and your government has secured deals worth of billions of dollars, you still need to watch this video cause I am gonna reveal some shocking facts that will make you understand how fragile this system would be not only for your country but for everyone around the globe. During pandemic, pharmaceutical companies compete with each other to develop vaccines and various countries compete with each other to get their hands on those vaccines first. In the current coronavirus crisis, more than 150 vaccine candidates around the world are in various phases of development. Okay, that's good, but will those vaccines reach common people like you and me on time or to the people who need them the most? Well, that is complicated. In the 21st century, we still do not have a robust vaccine delivery system that can ensure equitable access to vaccines for everyone. Now, if that fact is established, let us try to ponder upon the possibility of creating one. A system that can not only handle this pandemic but many future pandemics to come. Future pandemics? Isn't this the 1 in a 100-year scenario? No, not at all. In this century, we are more likely to face such outbreaks. If you do not know why, watch my recent documentary Post-Coronavirus World after watching this one. During the past few weeks, I tried a lot to figure out the global vaccine manufacturing scenario, but could not gather enough data. There is simply not enough research data available on global vaccine manufacturing. After going through hundreds of articles and industry reports, I could just find out these two things. Firstly, I could come up with this list of leading vaccine manufacturers and how many doses they can manufacture per year, with India's Serum Institute being at the top. Secondly, I concluded that vaccine manufacturers are not much transparent about their vaccine manufacturing capacities. Hey guys, in the past few days, I literally went through hundreds of articles and research reports but could not find much data on global vaccine manufacturing capacity. I went through the reports prepared by PwC, McKinsey Global, UNIDO, World Economic Forum and dozens of other firms. But nothing so far. When it comes to global energy production, automobile and electronics manufacturing, we have very specific figures to show. But as far as the vaccine manufacturing is concerned, not enough data. If we add all these numbers, we get to this number, 5 billion doses in 1 year. That much doses are enough to immunize more than half of the world's population. Sounds great, right? But guys, curb your enthusiasm. These numbers are highly exaggerated. Companies are bragging about their production capacities to attract buyers and investors. Also, these figures are based on if all goes well scenario. If we include failed trials, disruption in raw material supply, production, transportation and regulatory hurdles, as of now, our world can produce somewhere between 2 to 3 billion doses in 1 year. Enough to immunize 25 to 30% of world's population. But manufacturing a vaccine is only half the battle. After it comes the question of distribution. More and more countries are opting for bilateral agreements. They are dealing directly with the vaccine manufacturers. Deals of billions of dollars are being made as countries around the world want to put their citizens first. If you are living in a wealthy country and your government has already secured deals with dozens of vaccine manufacturers and now you are relaxed and breathing a sigh of relief, allow me to disappoint you by stating this fact, which is based on the authentic historical data. Research suggests that historically vaccine programs that have not yet entered human trials have a 7% probability of succeeding, which rises to 17% once they enter human trials. The US is by far the most aggressive when it comes to scoring deals for coronavirus vaccines. The United Kingdom is next in line. The country which has the highest coronavirus death toll of any European country has ordered vaccines 4 times its entire population. Then comes European Union, Australia and Japan. And countries like Russia, China and India are betting on homegrown vaccines. If you add all these numbers, you get this number, which is equivalent to our previously calculated global vaccine manufacturing capacity. So if all of the doses that are going to be produced in the next 1 or 2 years are being bought by rich countries, where would the poor countries go? Wait a second, why should rich countries care about the poor ones? I have answered this question in my recent documentary Post-Coronavirus World, but I will state it again. In today's globalized world, where global cities are interconnected and economies are interdependent, any local outbreak can give rise to a global crisis. The virus can always find its way to you if it exists anywhere on Earth. Even if you decide to isolate a virus affected country by blocking all the legal ways of doing business with it, the illegal trade will still remain operational, and the virus does not discriminate between legal and illegal. Let me authenticate my point by providing some real data. Venezuela has been a path to the United States and Europe for illegal drugs that originate in Colombia. These drugs are smuggled through Central America and Mexico to the US and through the Caribbean and West African countries to Europe. This map just represents cocaine trafficking. If we add more illegal drugs like heroin and cannabis, the trade network becomes more and more complex. This is the list of top 5 routes for drug trafficking. They are known as narcotic superhighways. Now take a screenshot, get a good map and figure it out yourself. Then we have human trafficking and wildlife trade going on as well.
God ever forgive us for what we've done to each other? And I look around and I realize God left this place a long time ago.
Even if we choose to ignore this, still blocking the trade activities with the middle and lower income countries will significantly affect global supply chains. For example, it is hard to imagine a thriving global diamond industry without rough diamond supplier countries like Botswana, Angola and the Democratic Republic of Congo. We all know how much Americans love diamonds, don't they? Besides, many developing countries are important raw material suppliers, and African continent, where most of the underdeveloped countries are located, holds 30% of the world's known mineral reserves. So the bottom line is, my nation first approach is not only bad for the world's fight against pandemic, but also for the rich countries who are aggressively procuring vaccines. Remember the fact I told you guys earlier about the very low probability of developing a successful vaccine. If a vaccine candidate fails, countries lose their money and our world loses invaluable time. In my whole research on this, I came up with this 4-step approach to resolve this issue. The tools are already available. It is just a question of proper global coordination and integration of all the tools available into the global healthcare infrastructure. Step 1. Coordinated global response. During any pandemic, as soon as vaccines get approved, a staggering global need confronts limited supplies and global bidding war starts, where the companies make a nice chunk of money selling vaccines that actually do not exist yet. In 1996, a cocktail of powerful antiviral drugs revolutionized HIV treatment in the West, saving many lives. But it took 7 years for the drugs to become widely available in Africa, the hardest hit continent. That was catastrophic. Again, in 2009, during the H1N1 swine flu pandemic, wealthy countries including United States procured huge share of global vaccine supply. President Obama had contracts that entitled the US to get 600 million doses. This move left undeveloped countries with very little supply until after the pandemic subsided. To avoid such scenarios, the whole world must deal with vaccine manufacturers as one entity and then initiate the process of distribution. Step 2. We need science, not politics. Countries together need to come up with some proper laws against hoarding vaccines. During the 2009 H1N1 influenza pandemic, Australia was among the first to manufacture a vaccine, but did not immediately export it because it wanted vaccines for its citizens first. Most countries have laws enacted that allow the government to force manufacturers to sell domestically, and this must change. We need science, not politics, to inform the global strategy. Healthcare experts have already come up with an effective vaccine distribution strategy that can slow down the transmission of any disease. As soon as the first vaccines get approved, healthcare workers around the world should get the first shots, then people at the risk of severe disease, then those who are living in areas where the disease is spreading rapidly, such as containment zones or red zones. It would be ludicrous if low-risk people in rich countries get the vaccines when healthcare workers in South Africa don't. We must leverage our global governance body to allocate, distribute and verify the delivery of vaccines. Global governance bodies such as the WHO, the Global Fund, CEPI and Gavi have come together to set up a system to accelerate and equitably distribute vaccines.
When the world has safe and effective COVID-19 vaccines, how can we make sure they reach the people that need them most? Today, there are many vaccines in development. Most will fail. For those that could succeed, governments are under pressure to secure supplies for their populations. If governments compete for vaccines, most countries could miss out. This is not only bad for countries that cannot secure their own supplies, it's bad for us all, as no one is safe until everyone is safe.
The Access to COVID-19 Tools Accelerator is a global collaboration to accelerate the development, production, and equitable access to new COVID-19 tests, treatments, and vaccines. It brings together leaders of governments, global health organizations, civil society groups, businesses, and philanthropies to inform a plan for an equitable response to the pandemic. We need equitable global access to tests, treatments, and vaccines to end COVID-19 fairly, effectively, and efficiently. Because if one of us is at risk, we're all at risk. We're only safe when everyone is safe.
So what are the benefits of using such a system? Undeveloped countries that cannot finance the manufacturing of vaccines will get access to vaccines to immunize their population, and rich countries get a classic insurance policy. If vaccine candidate chosen by these countries in a bilateral agreement with companies fails to materialize, these countries will still get vaccines to at least immunize 20% of their population. COVAX facility aims to manufacture 4 billion doses by the end of 2021, but their current capacity is enough to produce at least 2 billion doses. So 2 billion doses, out of which 10% will be reserved for the humanitarian purpose and acute outbreaks. And each participant country will get enough vaccines to immunize 20% of its population. Step 4. Local infrastructure and global supply chains. As far as rich countries are concerned, local vaccine delivery infrastructure is readily available, which includes healthcare workers, transportation, and cold chains that include advanced storage equipments. But when it comes to undeveloped countries, just donating vaccine is not enough. Am I boring you guys with this lengthy solution? It just does not seem to get over, does it? But what can I do, guys? There are just too many factors involved in this process. So stick around with me just for 3 more minutes. You can have a biomedical technology to develop a vaccine, but to deliver those medicines, you need to have the infrastructure, resources, and a robust delivery system on the ground. Cold chain requirement poses significant practical difficulties in effective implementation of immunization campaigns in third world countries where a reliable supply of electricity and cold chain storage is often lacking. To deal with this, COVAX facility intends to use a range of technical and infrastructural solutions. For example, COVAX is planning to invest in a variety of vaccine strategies. Single-dose vaccines could be easier to give in refugee camps, whereas a double-dose regimen might work fine at a European's doctor's office. Vials of doses can be shipped at relatively warm temperatures in the last stage of delivery. COVAX facility is aware of all this scientific data. Then to scale up supply chains so that vaccines could reach even to the remotest part of the world, COVAX has been trying hard to source its vaccines from companies in different locations so that no single country can stop them from being exported. They are also exploring some technological alternatives such as plant-based vaccines and more complex DNA-based vaccines. But manufacturing capacity is only available for developing vaccine candidates that employ traditional technology. For new technological alternatives, there is not enough manufacturing infrastructure in place. Everything will need to be built from scratch. Just like every other thing which exists in the universe, COVAX facility also has some imperfections. First, it is not transparent enough. And second, it has failed to proclaim pandemic vaccines as the global public good. Any global mechanism responsible for buying the vaccines on a global scale must be transparent about the expenditure, proprietary rights, and agreements. Why are they choosing certain companies? What conditions are there in the agreement? What happens if a company doesn't meet volume commitments? As far as COVAX facility is concerned, none of the terms and conditions are made public. If they are to get public funding, they need to be more transparent about what they are doing and how they are doing it. Most importantly, how they are using the funds. What happens if a vaccine candidate is not successful? What exactly are the conditions and criteria for investments? No strings attached strategy won't work when it comes to public funding. People need to know that their money is in safe hands. Now the second problem, what do I mean by proclaiming the pandemic vaccines as global public goods? Several heads of state have already referred to future pandemic vaccines as global public goods or the people's vaccine. In the current setup, pharmaceutical corporations are being allowed to retain and pursue intellectual property rights to the vaccines under development. As long as the intellectual property rights of vaccines belong to the pharmaceutical corporations, they are proprietary vaccines rather than the people's vaccine. Pharma alone should not decide who gets access to vaccines funded by the public. It's time to make global public goods a reality. As of now, COVAX facility model is by far the best shot we have got to fight this pandemic. It is a clever way to hold together the interests of different countries. Pooling demand with other countries through a joint mechanism vastly increases the probability of a success for each country and global success in stamping out a disease which does not recognize borders. This model, however, needs to keep evolving further if global bodies want to improve the global response to future pandemics. It didn't have to be this way. Experts have long warned that a devastating pandemic was likely to hit someday, but the international community failed to put in a place mechanism to ensure equitable access to a pandemic vaccine. So I hope it keeps evolving. This is me, Prateek, signing off. See you in the next video.